Hi, hope you're all well. I'm Viv and I'm the face behind Skinpharma Aesthetics in Stockton-on-Tees. And tonight, myself and Sunny, we don't have any guests on this evening. So we thought we'd just review the lives we've been doing over the last 7, 8 months or so since we started earlier this year. Hi Sunny, hope you're well. I'll just add Sunny. Hi Patricia, hi Stephen, hope you're all keeping well. Nice to see you joining us for this evening's live. I'll just add, we've spoken to a lot of practitioners from around the world about aesthetics and ultrasound use. Hi Sunny.
Hi Viv, how are you?
Fine, doing well, thanks. How's this week been for you?
Busy. So I had to race back from clinic. Race back from clinic just to get here on time. It's been a busy one. I think everyone is wanting treatments done,
Yes.
but it's when you get more senior, as we have done, both chronologically in age and in practice, you tend to start constructing your diary so that you can
Yeah,
manage your time better.
yeah,
Because I remember the days in the beginning when anyone would ring up and say, "Oh, can I be seen?" And you'd be like, "Yeah, just we'll fit you in." But
yeah,
actually,
yeah,
one, the question is that good for the patient? Is that good for
yeah,
you? For regulars, it's fine, but regulars
yeah,
would have booked in already.
yeah,
It's
yeah.
it's for the patients that are, "Oh, I can't get in with my practitioner. Can I just come and see you?" But
Yeah. As you get older and older, things change, I suppose, and you you need to do things a little bit differently, and you get more experience with different aspects of your work, I think. And patients you see regularly understand why you do things. It's a little bit difficult trying to speak to new patients about the same topics in the same ways, I think. But it's. I can't believe we've done 21 lives with practitioners from all around the world since April. I think we started doing these lives. And it all began with both of us starting to use ultrasound in our aesthetics work. You've got a big smile on your face there, Sonny, so I think you've been enjoying it as much as I have. Yeah.
it's a wine smile.
Cheers. Cheers. But I
No, I
thought it'd be
have, I
nice.
have. I mean, it's the most consistent thing that I've done. Obviously, I don't think I'd have been able to do these lives without without mutual support with your support as well. I think right
Yeah,
at the beginning we were flagging a little bit because it was something new. But to be honest, I take this time that we take out, that this 30 minutes on a Thursday evening, is time to focus on a subject that we're both passionate about, but
yeah,
equally that hopefully is adding value to those
yeah,
who people are watching. So
yeah,
definitely, I mean, yeah, ultrasound in aesthetics is here to stay. It's only going to develop further. We
yeah,
will hopefully be a voice of reason and sanity within a chaotic marketplace. Because without a doubt, I think that within 6 months we will be seeing other portable devices coming onto the market, probably from, it doesn't matter where they're from,
yeah,
if they're from China, if they're from Far East, or if they're from America, we will see more devices coming online,
yeah,
and because that's what happens in a competitive market. But
yeah.
hopefully we will be able to add value. But how about you though? I mean, first of all, your week. How's
Yeah.
your week been?
Oh, it's been good, busy. We've been having chats about all sorts of stuff in the background as well, about what we're going to be planning on doing in the future. Lots of patients to see, lots of complications still in terms of problems patients have had with other practitioners. They can't get issues solved because problems can't be identified and treated properly. So I'm getting more and more patients coming to me from other clinics because of issues they've had. Not recently, a lot of these problems have occurred from over the last 3, 4 years, and it's just a bit of a shame that things like this happen. But if you're able to deal with them, you're able to advise the patient properly about the issues that they've got, then ultimately, hopefully, things will improve for them. And
Well, I'm
it's
looking forward for us to both go to Amsterdam, and I think for those people who are watching, I don't. Is Leonie watching?
she's definitely watching. She
She is
watches us
watching.
every
Yeah,
week, Sonny.
she is watching. you know, going to Amsterdam and looking at a well-supported, well-resourced, evidence-based clinic for aesthetic medicine will help us to potentially, you know, bring that, some of that knowledge back, even if it's 10% of that knowledge in a chaotic marketplace where, you know, people are just turning up to you, aren't they? They, you know, you're standardized. I'm sure you put them through a pre-questionnaire and you guide them, but you know, for one practitioner dealing with all the problems in your area, I mean, that's a heavy burden. Whereas and that's where I can see us taking, you know, if you're watching and we get the support, is taking that further. Not necessarily, complications happen regardless. It doesn't matter who you are. They can happen to us as well, and they have happened. But it's how we can manage it for patient safety and for practitioner safety as well. So you're getting a lot of complications coming your way.
A lot of complications. I was talking to Leonie a while back about practitioners she sees at Erasmus in Rotterdam in the Netherlands, where she runs the complications clinic, and she's helped I think a group of plastic surgeons from Israel recently, a few months ago. I think she was helping them set up their own complications clinic in Israel, I think it was, and she's a really nice person, and she's you're able to talk to her about any issues, about any problems. She's a really nice person. And I know we mention her every week, but we do that because of the expertise, the knowledge, and the skill she has in doing the work that she does. And we don't just say Leonie for no reason. There is a reason behind mentioning her. But I think it's been nice talking to lots of different specialists from around the world, and so many different backgrounds, so many different specialists from all areas.
So on that note, we have had Brazil, Netherlands, USA, Australia, Morocco, UK, obviously, Canary Islands, Northern Ireland, Australia, Poland, Argentina, Germany, and you know, that is a massive spread. I mean, that's a global network. I mean, I didn't know how to do this, whether we do it very in an ordered way, but everyone that we've spoken to, I know we're both in awe of their expertise and knowledge. But we spoke to Carolina right at the beginning. What did you take from that as your kind of take-home message?
Carolina was probably one of the first practitioners I spoke to about the whole use of ultrasound when I first started using the device earlier this year, and she was fantastic in providing help and advice about starting off in use of aesthetics, in use of ultrasound in aesthetics work. So from her, I've learned a lot, you know, to begin with, and she's always been helpful in providing information and advice about how to progress and improve what you're doing. And in the live we did with her, I think she mentioned that she saw improvements in the work that I was doing with the scanner based on how I was working initially. It's not an easy area to start working in when you've never used ultrasound before. And Patricia Barrera's clapping there. I think she realizes as well just what support practitioners need. It's not an easy type of work if you've never done it before, and she knows as well as anyone just what issues you can have when you don't understand the use of ultrasound in aesthetics work. And
just correct me if I'm wrong, but Carolina's background, she is a radiologist.
Radiologist, she's based in Carolina. Actually, I think she's based in Argentina. I've put Brazil by accident, but
because obviously she knows Patricia as Patricia as well. Yeah.
They know each other, and I think they're progressing. They're trying to improve the whole aspects of complications learning in South America. So hopefully they'll do a lot more work in future.
I was impressed with Carolina's work as well, because she's already Argentina, Dr. Patricia's
Argentina, yeah.
That's my fault as well. I should have corrected Viv on that.
Yeah, you should.
But no, with Carolina's work, you know, from her own speciality, she was saying that it's looking at it from a very different perspective. Not very many radiologists know about facial imaging,
Yeah.
CT, X-ray, and MRI. Well, not even MRI, CT and X-ray is a go-to. But
Yeah.
using a dynamic method like that, and so it was nice to hear that from her, and
Yeah.
obviously getting those hints and tips about how to use it.
What did you think about the Dutch, about Leonie and Tom? I spoke to Tom a while back,
Yes.
and I enjoyed it. What did you think of
I mean,
their talk?
I mean, we're both biased, aren't we? They have a wealth of experience. I mean, you kind of if you mentioned 6 months ago when we started this, oh, we're using ultrasound, people were just like, whatever. I mean,
Yeah.
I had people saying to me, why are you wasting your money on ultrasound?
Yeah.
Like,
Yeah.
just spend the money on injecting, or spend the money on injecting courses. But
Yeah.
when I can't remember what, I think it was just watching one of the Clarios talks, but basically then, no, in fact, it was probably a webinar that Leonie had done. And as she was demonstrating ultrasound guided treatment of hyaluronic acid complications, it was like, well, this makes complete sense. But I think
Yeah.
we've only seen the tip of the iceberg in terms of the knowledge and
Yeah.
capability. The problem, I think, with where in Amsterdam it's very structured and it's a government recognized, supported, resourced training program. Every aesthetic doctor has to go through
Yeah.
that program, and obviously Leonie and Tom are part of the faculty. In this country, if there's a key piece of IP knowledge, it gets encapsulated, I'm using a complication term there.
Yeah.
It's basically encapsulated into this kind of, by a paywall, and the free bit, the knowledge bit, is lost, because then suddenly you're like, well, it costs this much to go on and that's the whole point of why we're continuing to do this, is that if you can just bring one hint or tip, how to hold the ultrasound, the application of it, its uses, and that, and so on. So no, I enjoyed it immensely, and I'm looking forward to going face to face and going to the clinic.
Hopefully we'll be able to go some point next year over to the Erasmus Clinic in Rotterdam and see Leonie, see Tom, Olga.
Dr. Olga, yeah.
Olga
So
as
what I
well.
would say for those people who are watching now, like, oh, these two guys are just blathering on about Amsterdam. Just go onto PubMed and use PubMed search for Leonie Schulk and Tom Decatas. Just look at the research papers. Because the work is there, and if you just look at it and then take it in context of what you're doing in practice, it will have, just take a minute, 5 minutes a day just to read the abstract, and just doing that will help you understand what you're doing much better, especially with the fear of complications.
Over the last few months, I think, I set up a research database on my website, on the Skinpharma website, purely because
I'll just say a free service, no charge.
Yeah, it's skinpharma.co.uk/research. You can register and you'll be able to look at research articles and abstracts from researchers from all around the world who do some fantastic work, particularly with the use of ultrasound as well. As I said, we've talked to so many.
What about Rosa? Rosa was very interesting. Rosa Siegrist. Yeah, she was a really interesting practitioner. What did you?
I again spoke to Rosa last year for a Christmas greetings video. That's the first time I contacted her. You've got to do one for me, Sonny. I think Leonie and Tom have done a fantastic video for me, so I'll be looking forward to putting them all together. But Rosa, really nice lady, she works with Barbara Parda in Poland as well, and the two of them organise training in Europe. So I think both of them do some fantastic work. Rosa, specialist radiologist, trains all over the world, and she does some fantastic research work as well. So really enjoy following her work. And thanks, Barbara. She's mentioning about the research service I'm providing through the website. It's a pleasure. As I say, there's so much fantastic work being done by specialists all around the world to look at how aesthetics practice can be improved by all practitioners. It really needs mentioning, the fact that they are doing work in the background. They're not getting paid for it. They're doing it in their own time. And I don't think it's being portrayed in a way that it should be. I think it's a lot of it's just completely being ignored, and
I
I
mean,
think it
it's
shouldn't
a little
be.
bit unrelated, and it's probably a shameless plug for Tom. And any of the people that we've spoken to, a shameless plug for their courses that they're
Yeah,
organising. I think definitely because these people, these practitioners are passionate about
yeah,
teaching, and yes, there
yeah,
is a cost, but that covers their time. But I think a lot of what I will say to any of the people that we've spoken to who are running courses, I think they plough that money back into developing the courses further and into
yeah,
their own research. So that, you know, it's stupendous. But Tom, I was fascinated with his genetic test
yeah,
that his
yeah,
company have developed,
yeah, yeah,
which allows patients with a simple cheek swab to see whether they are prone to getting granulomas, swellings, and so on.
yeah,
You know, the cost of the test probably is the cost of 1 ml of filler
yeah, yeah.
retail, and you know that's fascinating. But that test would not have come out unless he'd done the research behind it.
No. No, he developed that test as a result of his PhD. I think it was his
Yeah,
PhD work looking at adverse events with dermal filler treatments. And particularly, he did a lot of work to develop that test. And he has a company that's now trying to promote the use of that test around the world. But again, so many specialists. I enjoyed talking to Jose, over in Gran Canaria. He was a really nice
yes,
person. It'd be
definitely. And
nice to
he
visit.
runs a course as well, doesn't he? He's doing
Yeah, he runs a course, and again, because of him, I've got in touch with other dermatological specialists who use ultrasound around the world, and he does some great work in the use of ultrasound with hair loss, problems with hair loss. But
And
I enjoyed
then
speaking
we
to
had
all of them.
well, talking about dermatology, Professor Mariam from Morocco.
Yeah, Mariam
She
Idrissi.
was using it to scan suspected cancerous lesions, and she was
Yeah,
looking at you know, very innovative use that the vascularity within a
yeah,
cancerous lesion was so much higher
yeah,
compared to, and you could see the depth of that lesion as well. I mean,
yeah.
that was amazing stuff, wasn't it?
It was fantastic. And again, Jose was showing us some pieces of information about basal cell carcinoma and melanoma issues using ultrasound to detect problems and treat them as well. I think he mentioned about the use of ultrasound to provide data to surgeons who will be looking into, using surgical treatment of those problems, using the right depth, going into in the right depth. I enjoyed that. To be honest, there was no particular favourites. I love talking to all of these practitioners.
I I thought, I mean, not favourite wise because I don't get into trouble because we need to
Yeah,
invite everyone back on. Um, who? Okay, very personal question. So, and you can't say Leonie on this one. Who were you in a little bit of awe of? Like, who did you like? Oh my God, we're like speaking to this person.
in all of them, I think one of the people that really stuck out for me was Lynette Mays from Kalo Aesthetics. Not because she was some ultrasound specialist or anything to do with ultrasound in particular. It was purely because she managed to do what she wanted to do, no matter what. She wasn't always confident, but she had to grow up strong. And she gave us information about her background, how she grew up in Northern Ireland, problems she's had with trying to get better and improve what she's wanted to do. And she's managed to do some fantastic work in this last year. And her not quite stubbornness, but her forthright will to get what she wants. But do
I
it.
think I think what you're saying is so poignant right now because obviously nurses are on strike,
Yeah, yeah,
and I'm fully in support of nurses striking because
yeah,
it is a polarized issue. You either
yeah,
are for or against. There's no in the middle. You
yeah,
know, and I think Lynette Lynette's resilience, tenacity
yeah,
is typical of most nurses that I've met, especially in aesthetics, because people
yeah,
think, oh, you know, aesthetic nurses. Some are full-time aesthetics now, but they've been doing it for years. But they are still doing nursing on the side.
yeah,
They're
yeah,
still working in hospital or in primary care, and to manage for most nurses, whether male or female, to be fair, they're managing a family,
yeah,
kids, they're women, and they are also running a business, probably successful business, and then they're also working in NHS as well.
Yeah.
They are really contributing on lots of levels in society. Not that I'm not saying other people don't either, but it's just testament to the resilience of nurses. And I think I echo what you're saying in regards to Lynette. But, you know, again, really amazing woman. So, yeah, definitely, I would agree.
It was surprising, though, talking to, who was it? It was Mobin Master. The backgrounds behind these people, you don't always realise on social media that they don't always talk about things like the hobbies and the backgrounds, and that's what we delve into in the work that we do when we speak to them. But Mobin Master, being a DJ and a record producer, I was quite amazed by, because there's other DJs, aesthetics DJs around the world. I can't remember his name. There's a couple of DJs around the world, quite famous ones, and it's amazing that they do all this amazing work, you know, in the background that you don't even realise about. And I think Mobin still does a lot of
people
work.
like Mobin, we would say, are higher functioning individuals. I have no idea how they have hobbies on the side.
Well,
Go on.
I think it's Raj Aquila. I think he works with Allergan and a few other companies. He's a DJ. He spends time in Ibiza and all over the world DJing in the summer.
Listen, if you can land Dr. Aquila onto our podcast.
To be honest with you, I'll
podcast onto our live.
It'd be interesting to see what he thinks and his background as well. It'd be interesting to speak to him. But there's so many, excuse me, Sonny, so many specialists I'd love to talk to. I do need something to drink, actually. But it'd be nice to speak to others around the world next year, specialists we haven't spoken to, but also go over what work the practitioners we've spoken to, what work they've done over the last 6 to 12 months as well.
I think that will be. I think our focus for the Ultrasound Live is to really start delving into the work, into a bit more clinical detail. So I think, for those who are religiously watching, thank you. What we will do is not only delve into the clinical. We'll delve at it from a patient's aspect, from the practitioner's aspect, and really our goal was to always try and produce some standardization, and that is the plan for 2023, to really have the objective is to have a set of standardized protocols for ultrasound, a systematic way, but also have a fun bit as well, because we want to know more about practitioners. We want people to come on and talk to them. I mean, when we're talking, I'm sure it's boring. But when they come on, I mean, they really light it up. I will say that I blame you for this, but when Jake Sloan came on, obviously our friend, doctor friend from Australia, our basically ex-POM, I then started listening to Inside Aesthetics. Like religiously. So I mean, to be fair, when I'm having to drive for a fair distance to get to my GP locum jobs sometimes, and you can listen. And you know, if you're watching and you're a practitioner, listen to Inside Aesthetics, because it is so useful.
It's fantastic. David and Jake, both two fantastic individuals, and I was speaking to them after the live that we did with Jake, and because of the video work I was doing, you know, doing loads of work with graphics, etc., they asked me if I'd like to help them out a little bit with the Inside Aesthetics YouTube channel. The problem is, because of the work we'll be doing, Sonny, it's just, unfortunately, I'm just not going to have enough time to help them. But I
banned you from it. I basically said you can't do it unless they're going to pay you.
They were really nice, actually. But they've got a fantastic YouTube channel, and their podcast is amazing. Anyone who isn't a subscriber of Inside Aesthetics podcast, go and sign up, because they really are nice.
I signed up to Patreon or Patreon. I'm not sure what it is, which is Patreon, which is their kind of subscription channel. And you know, if for £6 or £7 a month, whatever level you choose, you get that inside. You know, you get the inside. It's behind the scenes chat about this podcast. So and it supports them, because I think they take a whole day out, don't they?
They do. yeah,
It's not like us on the fly on a half an hour after clinic. I think they spend up to $300-400 a
yeah.
day to produce their show.
They do. They spend a lot of money, and they try and get it to work as well as possible. They do a lot of background work that people don't realize. The audio needs playing with digitally, and they've got people in the background that do a lot of work for them. And they spend a lot of time, getting things right and helping people like us learn about the whole subject of aesthetics from specialists. And these specialists are all over the world, and it's
Do
it's a
they have,
privilege to be able to speak to them.
well, it's privileged information, to be honest. So
Yeah,
they have guests, they have the injector diaries, they have companies coming on, and they
yeah,
really do dig in with those companies.
yeah,
And I was, again, just chatting to Jake via WhatsApp. They edit their podcast so that misinformation doesn't go out.
yeah, yeah. They try and do things as clearly as possible, transparently. They try and get the info that people want to know about. They ask things that are important. They want to get facts, and they want to help people in the whole area of working in aesthetics, and that's what everyone wants. So I think they're two really nice blokes, Jake and David. I'm just sorry, both of you, that I'm not able to help you from January. But I hope your YouTube channel
They'll be
does
all
go
right.
well.
If they're all right, I don't think it's award winning, but I'm sure it should be. They've got an amazing podcast. I think
They do it. They're really nice blokes anyway. But
so.
yes,
I mean, Candice as well.
Candice, yeah,
We've mentioned doctors, but sonographers like Candice.
Candice, and also Lisa Hackett in Australia, both
Yes.
sonographers, and Lisa's a radiographer.
Yeah, I'm sorry I couldn't come on. I couldn't do that one. I was not in a good state.
I thought you were a little bit tired after your night shift, I think, last
Yeah,
week, Sonny.
but both.
But
Yeah, I mean, so I think, in the viewpoint of sonographers and what they bring, it would be really good to promote them next year. Any
yeah,
courses that a sonographer does, basically, it's fine. They may not have the practical knowledge of doing, needle to skin
yeah, yeah,
necessarily, but you need that MDT, multidisciplinary team support for
yeah.
imaging. You
Oh,
just
yeah.
can't do everything, and that's what we end up doing in aesthetics.
Well, I've been speaking to both Lisa and Candice, and both really nice specialist practitioners in the use of sonography. And hopefully, I'll be trying to help them, and they'll be helping me with bits and pieces to do with our lives. And we should get on well. And as I say, we've networked really well with these specialists, because the CMAC conference a couple of weeks ago, we met quite a lot of them. It was a shame we didn't get a little bit longer to chat with them there, but we were just so busy, and we'd never met either previously. So it was a chance for us to actually talk to each other. But it'd be nice to get them back in next year, and speak to more practitioners and look at things from the perspective of patients as well. Perhaps we'll get patients who might have had issues in the past, and how they could have been helped by the use of ultrasound, and specialists like the people we've spoken to. It'd be nice to do that, I think.
I think ultrasound is here to stay. I mean, we hope that it is useful that we do this every Thursday. I enjoy it
Yeah,
because it does get you thinking, and when I leave it with, especially with your work on the enhancement of scans and images,
yeah,
and that eventually, potentially, the software could incorporate that sort of work.
yeah,
You do it for the love of it, basically. And I remember you saying that we won't say who, but you went to some of the people that designed the software, and they were like,
yeah,
how are you doing this sort of thing?
yeah,
But
yeah,
AI needs to be trained. If anyone's watching now who knows someone who can develop AI algorithms, definitely DM Viv, because it
yeah.
takes time to train the AI in
Yes.
regards to those images, but once it's
Yeah.
trained, it will recognize it.
It's a bit like, in the media over the last couple of months, there's been more and more talk about artificial intelligence, and Open AI, the company that's been developed. It's been going for a while. They're doing a lot of work with chatbots, and using artificial intelligence to mimic human behavior in terms of written text. So I was feeding Open GPT, I think it's called. I was
Yeah.
feeding it some information based on a chat we had earlier today, just to see what it would come out with. And it's quite amazing the sorts of things it can actually produce from artificial intelligence. It's quite amazing what can be done. Hopefully in the future, similar technology could be used in ultrasound assessment and trying to help practitioners, you know, identify tissue, dynamic tissue movement, carry out
So
dissolutions.
ultrasound educator, Viv, that's is that
That's
Candice's?
Lisa.
That's
Lisa
Lisa, sorry,
Hackett.
that's Lisa. Yeah,
Yeah.
that's Lisa. Okay, well, bye, Lisa. Thank you very much for tuning in. But she's just saying, there you go. No, thank you. You're welcome. I look forward to getting to chat with you next year as well.
Yeah.
I mean, examples of AI, GPT-3, which is what you're
Yeah.
talking about, which is a new
Yeah.
iteration of
Yeah.
AI chat, basically, is amazing. But what have we seen so far in the aesthetics industry? Basically, practitioners having their photo augmented by
Yeah.
AI in
Yeah.
different. I mean, yeah. I mean, the irony of it is such a powerful technology. What we should be seeing is taking patients' faces
Yeah.
or anyone's face and seeing if how can the AI help us to
Yeah.
look at the kind of anti-aging elements of facial
Yeah.
rejuvenation. But
Yeah.
instead, the people that are making money out of it are these apps where they charge £3.49 for 100 images of you in different
Yeah.
formats. I mean, it's just
Yeah. It's
it's a
just not.
shame, really. I just get a little bit sad
Yeah.
when I.
The technology just isn't being utilized as effectively as it could be when you compare it to other areas of work. You know, the computing and technologies is improved massively over even the last 5 years. But when you look at aesthetics, very little change has occurred in the last
I mean,
five
so if
years in
anyone,
terms
if anyone's again watching, if you had an app where you could take a patient with their current skin problems, let's say sun damage, photo damage, and
yeah,
just say, this is what we can do, or this is what you will look like, or take a
yeah,
20-year-old. But I think
yeah,
even that was available even 5 years ago, but it's
yeah,
not available as an app. Sunscreen app, sun protection app. You put
yeah.
your face in. This is what you look like in 50 years' time. Just use sunscreen every day.
Yeah, yeah. Things will gradually improve, but as I say, all practitioners, you know, if there would, I know this will never happen because everyone wants to keep the data private, but if there was such a thing as being able to record your data centrally to look at the types of treatments a practitioner's carrying out on a patient, compare what the effect of that treatment is using a particular product in a particular type of patient. If that was recorded in the UK, imagine you had 1,000 practitioners doing treatments and all of that data was recorded anonymously. A computer, artificial intelligence could quite easily look at the patterns of products, types of injections, types of patients, and what the effect of certain treatments are in those patients. It isn't rocket science. It takes time. It takes
Well,
the ability to
but that's what
compile data.
that's why the NHS data that's
Yeah,
allowed to be mined is so valuable, because
yeah,
basically that's
yeah,
essentially that. So if we just had a central hub
yeah,
where, but the thing is, we're a cottage industry. There's thousands of us operating from wherever.
yeah,
Um, even if some of the training schools have developed CRM software where they said, look, you've trained with us, use our CRM software. That
yeah,
CRM software will anonymize the data of your injecting and the
yeah.
training school. But well, maybe someone needs to set up a training school that has some ethics behind it.
Perhaps they
Actually, I take
do.
that
Yeah,
back. Or I take that back. Has that concept behind it? Not ethics. I should take that back. Because all of the training schools that I'm sure they are ethical. The ones that we know of. But yeah, if from the very beginning the CRM was offered as part of your training package
yeah,
and that data could be recorded, the standards would
yeah,
have been set from day one. But it takes
yeah.
people to challenge the industry.
There's always ways of making improvements, and that could well be something that training schools could look at in future.
Well, I'm surprised you haven't gone down that rabbit hole of maybe the filler the
Yeah.
filler companies should be offering that level of.
We could have a whole argument about this whole aspect of aesthetics, Sonny. But I think we should mention also Dr. Uche. You know, we both know Dr. Uche. He's been known as the tea trough king. And he really is a nice bloke. I met him, not face to face, but online, because of lockdown about 2 years back. And he was a mentor. He still is a mentor for me. And
to be fair, he's a mentor for a lot of people.
Yeah, yeah.
Spending his time mentoring people, but he's not asking for money for it.
No, he's not. But his whole idea of keeping things clear, transparent, and getting to the true facts of an issue. That's what he wants to do. And I think, you know, it's a shame that he gets such resistance from certain areas of aesthetics. Some of the posts he's been writing over the last couple of months have been related to different areas of work, not particularly the technicalities of injecting. It's the whole area, in the different areas of working as a practitioner and what issues come up for different practitioners. And it's good to be able to hear him. I think he's really bold in some of the things he says.
I don't think it's being bold. I think he's just being pragmatic and practical with the questions he's asking. But anyway, we'll go down the rabbit hole. I think we've been talking for half an hour, Viv. Come on, wrap it up for us.
Okie dokie. As I said, we did this live tonight just to sum up the whole series of lives that we've been doing since earlier this year, April or so. We've both enjoyed it. I've loved doing all these lives this year, and I think you have too. We'll continue from January. I think we'll have a couple of weeks break, do you think, over Christmas and New Year?
Well, because we need that time just to work on a couple of projects. I think we'll be using the time next Thursday, and what will end up happening is that we'll be talking about a topic, and I say let's just go live. But I think for the next couple of weeks, we'll be working on something that ultrasound related. We're both passionate about, and just planning for 2023. Yeah. But
we'll be back January, probably the first week in January. We'll start doing more lives, and hopefully people like Lynette will carry on following us. She's been really nice. I think she's followed us from the very beginning, since we started. And we will talk to more practitioners. We'll speak to people that are thinking of using the devices and ultrasound. People that have been using it a long time, and we may well speak to patients as well. It'd be nice to actually get a range of views on the whole subject, including patients, because I think it's important, those that may have had problems, those that may have been treated using ultrasound, I think it'd be nice to do that as well. So I'm looking forward to the lives that we have next year, and we will review the ones that we've done over the last 6 to 8 months. And we'll speak to these practitioners again who we've loved talking to over this last year. So I just wanted to say thanks to everyone, and it's been a pleasure to be able to do all these lives with you, Sonny. Yeah, likewise. Back at you, mate. So no, very, very good. And thank you everyone for watching. And we were back in the new year. And thank you so much. Have a good Christmas, have a fantastic New Year, and I will catch up with you in the next live, possibly in the next couple of weeks, but we'll probably do them properly in January onwards anyway, Sonny. Definitely. Thank you everyone for watching. Really appreciate it. Great. Thanks a lot. Bye-bye. Bye, Viv. Bye.